Hi everyone, my name is Dr. Santosh Kumar Gupta, medical coding trainer from Medesun Medical Coding Academy. 8 years of experience, 43 certifications, and I'm world record holder in medical coding and billing. Today I'm going to explain you about the compliance and regulatory. As per the AAPC website, you are going to get 3 to 4 marks in the exam from the compliance and regulatory section. And please make a note that compliance and regulatory knowledge is must for the live work. Okay. So as per the AAPC website, these are the topics covered under the compliance and regulatory section. Medicare 4 parts A, B, C and D, ABN, CLIA, NCCI, HIPAA and other guidelines. So why compliance knowledge is must for the medical codes? Because when you assign the medical codes, you are supposed to assign the medical codes as per the medical coding guidelines, official coding conventions and as per documentation. So you should know about the ABN, you should know about the NCCI, you should know about the HIPAA guidelines, you should know about the OCR, you should know about the OAG to assign medical codes to get the proper payment and to prevent the audits. Hence, compliance and regulatory knowledge is must for the medical coders and billers. So coming to the Medicare, Medicare is the largest health insurance payer in the United States. It is federally funded and it is maintained by the CMS. So Medicare, you know very well, it's free for people who are above 65 years of age and ESRD and ALS. It covers almost 43 million individuals and Medicare has 4 parts, Part A, Part B, Part C and Part D. This is very important. Please make a note. Part A covers hospital insurance, Part B covers outpatient, Part C is a Medicare Advantage plan and Part D is prescription drug coverage. I repeat once again, Part A provides coverage for the inpatient services, Part B provides coverage for the outpatient services, Part C is a Medicare Advantage plan and Part D is a prescription drug coverage. So Medicare Part A. So Medicare Part A covers all inpatient services like hospice, SNF, respite care, psychiatric hospitals and home health care, etc. And these are paid as per the DRGs. Medicare Part B. Medicare Part B provides reimbursement for physician services, all outpatient services and also ambulatory surgical procedures, preventive services and all screening tests like mammograms, colorectal cancer, etc. covered under Medicare Part B. So Medicare Part A covers the inpatient services, Medicare Part B covers complete outpatient services like preventive services, screening mammograms and ambulatory surgical services. So Medicare Part C. Medicare Part C is known as Medicare Advantage Plan. What are the gaps are there in Medicare Part A, Part B, Parts D in A, B and D are covered under Medicare Part C. For example, dental care is not covered under Medicare Part A, not covered in Medicare Part B. So you can take Medicare Part C to cover the dental coverage for dental services. So Medicare Part C covers the services which are not in the Part A, Part B and Part D. That's why it is called Medicare Advantage Plan. Okay, and Medicare Part D is a prescription coverage program. So it covers all the prescription drugs under the Medicare Part D. And if you want this PDF document, you can comment with your email ID and we are going to email you the complete PDF document. So because of the time restriction, I'm going to explain only a few things here. And you can email me the email ID under the comment section. I can provide you the complete PDF. Fiscal intermediaries. This is a very, very important term even when you do the job also. So you cannot submit the claim to Medicare directly. CMS contacts the FIs. FIs, they apply NCD, means National Correct Coding Determination, and NCCI, National Correct Coding Initiative. So NCDs and NCCI edits are applied to the submitted claims to determine the appropriate payment. Okay, so about NCD, NCCI we discuss in Part 2. But please keep in mind, you cannot submit the claim to Medicare directly. CMS contacts with the FIs and FIs will apply the NCD and NCCI for the proper payment. A Medicare Part A and Part B claims are paid by the MACs. MAC means here Medicare Administrative Contractors. So I think you listen this word called par physician, non-par physician. Par physician means any physician who accepts the assignment on all claims is called par physician. Medicare pays to the physician directly. Who is non-par physician means non-participating physician who whether they may not accept the assignment. Means non-participating physician does not accept the assignment. Medicare pays to the patient directly. If patient goes non-participating physician, it costs more to the patient. Okay, that's why people they prefer to go to a par physician. Par physician means here participating physician. Next, very important topic is Medicare secondary payer. So under coordination of benefits means the responsibility between the first and second payer, or third payer, right? That is called COB, coordination of benefits. In case of workers' compensation insurance, MVA motor vehicle, EGHP, in these cases, Medicare is always secondary. So please keep in the mind, workers' compensation insurance, MVA and EGHP, any group health plans, Medicare is a secondary pay. It is called MSP. So they will ask in the exam, Medicare is secondary whenever the patient has workers' compensation insurance or MVA or group health plans. Next, Medicaid. So Medicaid is health insurance program for the low income people. Medicaid is state administered program and it may vary from state to state. Okay, and Medicaid does not pay money to the patient. Instead, Medicaid pays payment to the healthcare providers. TRICARE. So TRICARE is regionally managed healthcare program for the active duty and retired members of uniformed services like Army, Navy, Air Force, etc. Okay, so Medicare, Medicaid and TRICARE. So I'm very clear. Medicare is for people above 65 years of age, ESRD and ALS. Medicaid is for the poor people who cannot afford the health insurance, and TRICARE is for the active duty or retired members of the uniformed services. Workers' compensation is a state administered program and is legally mandated to benefit the workers, especially when they're injured in the work or when they develop the job-related illness due to their employment. So whenever workers' compensation and Medicare is there, always keep in the mind, workers' compensation is always primary and Medicare is secondary. Okay. Next, NPI. NPI means National Provider Identifier. So as per the HIPAA, every provider must have a unique identifier called NPI, National Provider Identifier. NPI is a 10-digit number assigned to each provider. NPI number, you can get the information from the NPPS website. So please make a note, it is called NPPS website. Next, CLIA. So what is CLIA? CLIA means Clinical Laboratory Improvement Amendment Act. So the CMS regulates all laboratory testing. So CLIA is a program to ensure accuracy and quality and timeliness about the laboratory testing. Okay, but some tests are very simple. For example, if you take ESR and blood glucose testing through any monitoring device, fecal tackle blood, they are simple tests. And for these tests, CLIA is waived. Means what? These are called CLIA waived test. Okay, so whenever physician performs a CLIA waived test, like simple ESR or blood glucose test through any monitoring device, you have to assign a modifier QW. QW indicates it's a CLIA waived test. You have to enter into the block number 23. So this is very important for the medical coders and billers. Remember the modifier, HIPAA modifier QW means CLIA waived test. Global period, I think you know very well about the global period. So all medical coders must know about the global period. Every CPT code has global period like 0 days, 10 days or 90 days. So remember, global period includes pre-op, surgery and post-op. And to get the more information, you have to go to the MPFS. This is a Medicare Physician Fee Schedule from CMS website. If you want the more details, please comment in the comment box with your email ID. I will provide you this PDF document and the MPFS file. fraud, abuse. This is very, very important for the medical coders and billers, and especially for the CPC exam point of view, right? So fraud means intentional deception or misrepresentation by a person for the financial gain. Like what? Knowingly billing for services not provided, knowingly falsifying claims or medical records, misrepresenting the dates, anything, any misrepresentation for financial gain comes under the fraud. And as per the HIPAA, fraud has serious consequences like civil and criminal penalties. Abuse includes any action that may directly or indirectly result in the unnecessary cost to the Medicare program, improper payment for services that fail to meet the medical necessity. So remember this very, very important point. Abuse means any action that may directly or indirectly result in the unnecessary cost to Medicare, like improper payment for services that fail to meet the medical necessary services. Okay, so fraud is intentional. Abuse talks about the actions that they cost the Medicare unnecessary money, right? So the difference between the fraud and abuse. Okay, so as per the AAPC website, you are going to get 3 to 4 questions from the compliance regularly. In that, Medicare Part, all 4 parts, and also about the HIPAA, the fraud and abuse. Now you should also learn about the NCCI, ABN, NCD, LCD. So we discuss more under the Part 2. Okay, if you want this document, you can comment in the comment box, and I'm happy to email you the PDF document. Thank you. Bye-bye.